Just going to take you through this PowerPoint. Quick introduction. So this session will last approximately about 30 minutes, and the aim is to give you an idea of what studying a BTEC will be like. If you have any questions, type them in the chat box. Your questions will be anonymous and we will do our best to answer them. The three courses and programs of study that the Health and Social Care Department offer include the Btec Extended Certificate in Health and Social Care. It's equivalent to 1 A-level. The Btec Diploma in Health and Social Care, double award, which is equivalent to 2 A-levels. And then the Btec Extended Diploma in Health and Social Care, which is equivalent to 3 A-levels. An overview of the Btec Certificate. So in year 12, you study 2 modules. Unit 5, Meeting Individual Needs, which is an internal unit, which means it's assessed through assignments. And then later, Unit 1, Human Lifespan and Development, an exam-based unit. And the exam usually occurs at the end of the summer, around May time. Both the content included for Unit 5 and Unit 1 are based around individuals. Unit 5 looks at meeting individual needs, so individuals with specific conditions. How can you produce a care plan that would basically support the individual? What type of carers are there? What type of voluntary workers are there? And also the different methods that the different communication methods that can support the individual. Then I have Unit 1, Human Lifespan Development, which focuses on physical, intellectual, emotional and social needs of an individual. And we look at all the lifespans here. So the difference between the needs for children compared to adults. In year 13, there's 1 exam-based unit, Unit 2, Working in Health and Social Care. And this is basically looking at different careers, different professionals and their roles and responsibilities. And then this is followed on by Unit 10, Sociological Perspectives. Sociological Perspectives explores different sociological views in society. It also looks at 2 models, so the biomedical model and the social model of health. And alongside this course, you can study 2 other A-levels to complement your A-level, again with health and social care. Second option, 2 A-levels. So as I've already gone through the units for the 1 A-level equivalent, all of those units would be studied in year 12, so Unit 1, 5, 2 and 10. And then moving on to year 13, they focus on Unit 4, Inquiries into Current Research in Health and Social Care. This is an exam-based unit and it includes current issues and different types of research and data around health and social care. So students will have the opportunity to look at quantitative, qualitative data. They'll explore different issues and they'll also be able to view, they'll also be able to make judgments around this research. So is it biased or not? And this is followed on by Unit 7, Principles of Safe Practice in Health and Social Care, mainly based around legislation and health and safety within care settings. Unit 8, Promoting Public Health, and then you have Unit 11, Psychological Perspectives, which gives us a good overview on different perspectives and how to treat a range of conditions, also looking at mental health and different theories around psychology. So with this program, you have the opportunity to study another A-level as well. Finally, our most popular program is the Btec Extended Diploma. So this lasts between 2 years and it is equivalent of 3 A-levels. So you would not study any other subject alongside this unit. So sorry, this course. So year 12, you can see the different units include 1, 5, 2, 7, 10, 11. And additionally, what's different about this qualification is that we offer Unit 6, which is a work experience in health and social care. This includes going out, opportunities of placement, and exploring different health settings. So currently our students are sort of trying to plan their visits to different healthcare settings. Their placements will fall around March time for year 12. Previously, our students have gone out to hospitals, they've gone into care settings, they've also gone to childcare settings, and they've really enjoyed the Unit 6 work experience aspect of health and social care. It gives them the opportunity to put theory into practice. In year 13, they have 2 exams, and that includes Unit 3 Anatomy and Physiology for health and social care. Now, this is quite an important unit, especially for students who want to go into nursing and midwifery or any science-based sort of careers that health and social care can lead to, because this is it does explore the human anatomy and it looks at different conditions as well. So it's a really important unit. Unit 4, again, inquiries into current research is also involved there, and this is a supervised assessment, which is again exam based, and then they also have another opportunity with Unit 6 for their work experience. The other units studied in year 13 include Unit 8, 18 Assessing Children's Development, and Unit 14 Physiological Disorders, and Unit 19 Nutritional Health. So there's a bit of a balance there with looking at some science-based subjects, and then you also have some childcare in there, and then you have the history of public health as well included, and nutritional health, which a lot of our students most enjoy, because they could really sort of bring this home as well, and they get a chance to create nutritional plans for a client or themselves as well. So quite an interesting one. With regards to assessment, so it's a 40-60 ratio here, so 40% external assessment. This consists of 3 written exams and 1 case study completed under supervised conditions. And then the 60% is internal assessments, and this consists of coursework, and usually there's 2 assignments per module. And then finally, you have the 100 hours work experience in health and social care settings, and this is for the extended diploma, the 3A level version. With the 1A level and 2A level, the external assessments are still around 40% as well, but you've got a smaller course, and most of them are taking 1 exam per year. Okay, so what do our students go on to do with health and social care? So it's a really broad subject. A lot of our students have been successful in getting into the following careers, such as nursing, paramedics, midwifery, occupational therapists, social worker, teaching, and there's a range of other career pathways as well. So for example, if you chose the 1A level pathway, so you've chosen health and social care alongside criminology and psychology. One of our previous students went into doing something around forensics at university. So with the A-level options, you can choose other subjects that are complementary to the course and also lead you into different pathways. With the extended version, again, it's also a very well recognised qualification in universities, and it really does lead you onto many different courses. So it is a case of researching where this course can lead you and phoning up universities and asking them about health and social care, Btec Health and Social Care, because it is very recognised. Our course requirements, so we follow the general college requirements 2 grade 6s at GCSE or merit or the equivalent, and a further 3 grade 4s at GCSE or the equivalent. Students who have a grade 3 in one of the 2 key subjects will be required to retake this at GCSE. So for example, like your maths and English, if you do need to retake, you will have to do this alongside the Btec Extended Diploma. GCSE equivalent courses include Btec First Awards or the OCR Nationals. Enrichment links. So with our enrichment options, you can see what is available on the college website. One that some students do choose is Health Ambassadors, and this complements the course as well. Although there are many other options, sometimes students choose a enrichment that helps them with the course, and Health Ambassadors is one of those options. So that's a popular one. I believe there's also elements of there's some elements of like psychology, enrichment around there, and there's many other opportunities, but there is a list on the college website, so you can have a look at it on the college website. Okay, so are there any questions?
Hi, Simi. Yes, we have some really good questions, a couple of good questions come through actually. So we've got one that is, how many hours per week are the students in college for, and how many additional hours at home are recommended? Brilliant.
Okay, so in college, if you're on the extended or the A-level pathway, you would follow a full timetable. So that's Monday to Friday. We expect students to be in from 9 to 4, so your timetable could fall under those hours on any day. You do get some free periods. We do encourage students to use our facilities like the LRC to revise and use those facilities in between. A good question about how much time should be spent outside college. So at a daily basis, you would be getting some sort of homework, and the reason being is because we have on some of the modules we have about a 30-hour recommended independent sort of research or independent work. So you would be spending around 30 hours independently as well. So there is a hope, well, not a hope, expectation that students complete homework, complete coursework at work, at home, and also spend extra time with revision. So about 30 hours, I would say, at home independently. It does sound like a lot, but when you break it down through your day, through 3 periods and during evenings, it does sort of pan out, and students should be able to do that. Is that in?
Yeah, that's good. How many placements are there in year 13, and how is it? How do we source it?
So there is 100-hour placements. So in year 12, you get the opportunity to go on about probably 2 placements, and then in year 13, you get to go on 1 placement. We manage it through block weeks. So 3 block weeks, and each lasting a week. You could pick 3 different healthcare settings. So it gives you a variety of settings and placements to explore. And the way we source placements is we do ask students to find their own placements. We guide them, help them on the process. So if they need to sort of contact places or think about covering letters, etc., we do guide them to how to do that, and then they can source their own placements. A lot of students also have contacts as well. So I've had some students working in hospitals through contacts, friends and family. So we could also source placements through that way as well. Once they have a place, so once they source a place, we do a health and safety check on that placement and make sure that they're insured for work placement and work experience. Students are DBS checked as well. So the DBS is about £60 at the start of the course, and then once they have their DBS, it means that they can work in any sort of vulnerable sort of care setting or health and social care setting. Does that answer that question, Matt?
Yeah, I think so.
Yeah.
We just had one come through. What subjects do you need for nursing?
So what subjects do you need for nursing? So for nursing, so if you were to go on to nursing, if you were to do the Btec Extended Health and Social Care, that is a very recognised qualification for nursing. So the triple 3 A-level route would get you into nursing. But at the same time, if you also picked, say if you picked 1 A-level health and social care route certificate, and then alongside that you did biology and maybe chemistry or sociology or psychology, that would also allow you to get into nursing to university. So there's 2 different pathways when you get into university for nursing. So you do, I would advise, call up the universities, check what they prefer, but I can certainly say that Btec Extended Level 3 Health and Social Care triple pathway can get you into nursing, midwifery, paediatrics as well, and paramedics.
Brilliant.
Yeah.
I think there's one more.
Mm-hmm.
So hours in the classroom per week, is that how many hours in total?
In total,
Yeah.
Right, so I'm just thinking. So probably about 9 to 10 hours in total, right? And the reason being is I'm thinking you've got 3 teachers, 3 strands, a bit more than 10 hours actually, probably 12 to 13 hours in total in the classroom throughout the week. Your lessons, the lessons are 1.5 hour lessons. So you'd have 3 teachers. Each of those 3 teachers would deliver at least 2 or 3 different modules, and you would have 5.5 hours for each teacher. So about 15 hours. Hope that answers your question.
Yeah, I think that's it. I mean, I don't know if you want to give it another minute, see any more coming now.
Yeah, definitely. I mean,
So we'll stay on SEMA for 2 minutes.
Yeah, I could talk about our department. So
yeah, okay, go for
what makes us quite unique, our department, so we're a sort of nice friendly department, 8 people in our department, and the teachers are very supportive, friendly. You get to know us and recognise us because we're all based in one building. It's the art building, so you get to see some good artwork when you come in. In terms of support, you'll have access to 3 teachers, different modules, all very supportive. We all encourage to get the highest grade that you can, which is a distinction. You'll also have an academic coach who oversees your sort of like learning. Well, whilst they're doing that, they also support anybody with any additional needs as well. So there's facilities for ALS students as well. And another thing that makes our department quite unique is the grades. So if you have a look on our college website, you will be able to see that over the past 3 years, all of our students have been leaving with distinction star and triple distinctions, and they've been getting into fabulous universities, and they've been going on to do some good things. We do have 100% pass rate, and all teachers are very qualified, and they're qualified in their subject areas. So our teacher who teaches sociology has a huge passion for it, degree in sociology background, and then we also have like teachers with anatomy and physiology background. So they're very sort of supportive, so you have that support there, and we do encourage you to get the best grade that you can. So it helps you to get into the university or helps you to get into your desired career pathway. Is there any more questions?
No, Seema, I think we're all good. Okay.
Well, if you do have any more questions at a later stage, you can contact the college, ask questions. Everybody's quite sort of happy to help here and answer any questions that you have. So thank you for listening to my presentation, and I hope to hear from you soon. Bye.